These 8 daily habits can help lower your creatinine levels and improve kidney health. High creatinine levels indicate kidney disease, and managing these levels can help you avoid the pain and costly treatments associated with advanced kidney issues, such as dialysis. Before we dive in, please note that all the information in this video is created by real people, thoroughly fact-checked, unbiased, and reviewed by qualified professionals. 8. Avoid over-the-counter anti-inflammatories. People often take over-the-counter, OTC, non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, Advil, Motrin, naproxen, and aspirin for pain, cold, flu, and fever symptoms. However, NSAIDs can be damaging to people with kidney disease. When the kidneys aren't functioning properly, they rely on chemicals called prostaglandins to help keep blood vessels open and improve blood flow. NSAIDs block the production of prostaglandins in the kidneys, preventing the needed vasodilation and necessary blood flow. A 2021 study published in the journal Healthcare, Basal, examined how 18 months of low-dose aspirin use affected patients with severe kidney disease who were not on dialysis. Out of 12,000 patients, the 3,000 who took aspirin had a 15% higher risk of starting dialysis. While low-dose aspirin is often prescribed to prevent cardiovascular disease in patients with kidney disease, it may worsen outcomes for those with severe kidney disease. Additionally, having caffeine along with NSAIDs may increase the risk of kidney damage. Caffeine raises blood pressure, causes renal vasoconstriction, and increases urination and dehydration, further decreasing blood flow. If you do take NSAIDs, make sure to drink plenty of water, or better yet, avoid them if you have chronic kidney disease, CKD. If you have CKD, you may wonder what medications are safe to use for pain. In early kidney disease stages, taking NSAIDs for a few days may be low risk, but your kidney specialist should supervise longer-term treatment. Higher doses of NSAIDs increase the risk of electrolyte imbalances, high blood pressure, and worsening kidney damage in people with advanced kidney disease. NSAID treatment should be personalized based on the severity of your kidney disease, overall health, the medications you are taking, and your age. Ask your doctor for advice about taking OTC NSAIDs and learn about their safety and any alternatives you may use. Before taking OTC medications, check each product's label for its contents or warnings. 7. Eat more fiber. Increasing fiber in your diet may significantly prevent chronic diseases that cause kidney damage. One of fiber's many benefits includes lowering the amount of creatinine in the body. Consuming dietary fiber helps feed gut bacteria that break down creatinine and reduce inflammation. Fiber also helps prevent constipation and balance cholesterol, blood sugar, and blood pressure. A 2022 meta-analysis published in the journal Nature reviewed the impact of fiber intake on kidney damage, showing mixed results. The variability may lie in the difficulty of studying individual nutrients. One study of over 3,500 patients showed no effect of dietary fiber intake on creatinine levels. However, another study showed fiber's positive impact on disease prevention and inflammation reduction, which also helps decrease the rates of kidney disease. Another study found that individuals with kidney disease who reduce their consumption of a Western diet while adopting a plant-based diet have higher survival rates. The Dietary Guidelines for Americans, DGA, recommend that most adults consume 28 grams of fiber daily. Fiber is present in all plant food sources, including fruits, vegetables, whole grains, and legumes such as beans, chickpeas, and lentils. Adults should eat 3 to 5 ounces of whole grains daily and 1 to 3 cups of legumes weekly. Additionally, they should include 1.5 to 2.5 cups of fruit and 2 to 4 cups of vegetables in their diet daily. A dietitian can provide appropriate recommendations for people who must watch their blood potassium levels, such as patients on dialysis. Examples of foods that contain lower potassium and higher fiber include legumes, vegetables, cooked broccoli, cabbage, radishes, beets and cauliflower, and specific fruits, pears. Incorporate a variety of fruits and vegetables, such as apples, strawberries, and watermelon, into your diet. Brazil nuts, sunflower seeds, and oats can also offer benefits. To reduce potassium levels by more than half in fruits and vegetables, wash them thoroughly in cold water. Chopping these foods increases their surface area, enhancing the rinsing process. Western diets are often low in fiber. Transitioning to a whole food, plant-rich diet can enhance fiber intake and support kidney health. If you're enjoying our video, please show your support by liking it, and we'll continue creating similar content. 6. Limit salt intake. Your doctor might have discussed your salt consumption, as excessive salt can lead to elevated creatinine levels. While sodium is essential for bodily functions, most Americans consume it in excess. Processed foods and restaurant meals contribute the most sodium to the American diet rather than natural sources or salt added during home cooking. A 2020 study in the International Journal of Molecular Sciences found that individuals with early to severe stages of chronic kidney disease, CKD, benefit from a low-sodium diet. In the early stages, such a diet reduced proteinuria, protein in urine, and enhanced the effectiveness of blood pressure medications. In later stages, a salt-restricted diet helped prevent fluid overload and reduce the number of dialysis sessions needed. Excessive salt raises blood pressure and fluid levels in the body. This increased pressure and fluid can narrow the blood vessels in the kidneys, impairing their function and leading to a buildup of waste, including creatinine. For dialysis patients, managing salt intake is crucial to prevent high blood pressure and heart enlargement, as dialysis machines may not effectively manage excess salt. A low-sodium diet can improve outcomes for those with kidney disease. The Dietary Guidelines for Americans, DGA, recommend limiting sodium intake to 2,300 milligrams per day for individuals aged 14 and older without health concerns, equivalent to 1 teaspoon of table salt. Patients with kidney disease should aim for less than 1,500 milligrams daily, or just under 3/4 of a teaspoon of table salt. A diet focused on whole foods generally reduces salt intake, as high-sodium foods are often processed, packaged, canned, or restaurant-prepared. Develop a habit of consuming low-sodium whole foods and reading food labels. Avoid packaged foods with more than 400 milligrams of salt per serving, and use less salt when seasoning. Remember, sea salt and table salt have the same sodium content. Consider using herbs and spices to add flavor instead of salt. 5. Exercise regularly, but avoid overexertion. Individuals with kidney disease often have lower physical activity levels. However, regular exercise has been shown to improve creatinine levels and glomerular filtration rate, GFR. Exercise supports kidney function by reducing inflammation and slowing tissue damage from waste buildup, and it can enhance blood flow to the kidney's small blood vessels and tubules. Research shows that safe aerobic and strength training exercises over 6 months provide significant benefits. Tailor your exercise program to your fitness level, starting with low-intensity activities like walking, swimming, or with lightweight lifting. Gradually increase the intensity, frequency, and duration of your workouts as your body adapts. Aim to include high-intensity exercises like running or vigorous dancing over time. Spread your exercise sessions throughout the week for optimal results. Stay hydrated and avoid overheating to prevent overexertion and potential kidney complications. If you have kidney disease, diabetes, or heart disease, adjust to exercise gradually before increasing intensity. If you experience dizziness, chest tightness, or difficulty breathing, stop and consult a healthcare provider before resuming. Regular exercise can aid in managing chronic kidney disease, CKD. 4. Stop smoking. The detrimental effects of smoking on kidney health are well documented. Smoking accelerates kidney disease progression, especially in individuals with a GFR below 45 ml/min. Nicotine and other chemicals in cigarette smoke can narrow the kidney's small blood vessels. Long-term smoking can also lead to conditions such as atherosclerosis and renal artery stenosis, which harden blood vessel walls and reduce blood flow to the kidneys, increasing blood pressure and impairing filtration. A 2022 study published in the Journal of Multidisciplinary Healthcare found that increased smoking was associated with higher creatinine levels. Fortunately, quitting smoking can lower creatinine levels and reduce the risk of further kidney damage. Although quitting can be challenging, the benefits are significant. Fortunately, there are numerous tools available to assist you in quitting smoking. Consult your doctor for resources such as counseling, medications, or nicotine gum. Seek support from loved ones and set a quit date. Anticipate challenges and consider strategies to ease the process, such as frequenting smoke-free environments or spending time with non-smoking friends. You might also need to develop methods to handle difficult emotions, such as using relaxation techniques like deep breathing and meditation. For those interested in the evidence behind these recommendations, studies supporting our claims can be found through the link in the description box. 3. Prioritize high-quality sleep. Individuals with chronic kidney disease, CKD, often experience sleep disturbances due to various factors, including restless leg syndrome, mental health issues, sleep apnea, and side effects of medications. Severe CKD can exacerbate these issues through toxin buildup and chemical imbalances resulting from impaired kidney function. Regular dialysis can disrupt the sleep-wake cycle, leading to further sleep challenges. Achieving high-quality sleep, typically between 6 and 8 hours per night, is crucial for lowering creatinine levels and preventing further kidney damage. Good sleep is linked to fewer disturbances, such as trouble falling or staying asleep. Although the precise mechanisms are not fully understood, adequate sleep may mitigate risk factors for kidney disease, including diabetes, obesity, and high blood pressure. It also helps avoid the stress response and inflammation that can damage kidney filtration systems. A 2019 study published in the Journal of Clinical Sleep Medicine found that individuals with sleep disturbances, inadequate sleep, less than 4 hours, or those using sleep aids were at a higher risk of developing chronic kidney disease over an 8-year period. Prioritizing both the quality and quantity of sleep may help prevent worsening kidney damage. Early identification and management of poor quality sleep are essential. Treatments can include medications for restless legs, cognitive behavioral therapy for sleep difficulties, and optimizing fluid removal during dialysis to improve sleep apnea. 2. Embrace a plant-based diet. Adopting a predominantly plant-based diet can significantly enhance kidney function and lower creatinine levels. This diet is safe for individuals with CKD and can improve glomerular filtration rate, GFR, delaying the need for dialysis. A plant-based diet also supports better management of unhealthy cholesterol, weight, blood sugar, and blood pressure levels, reducing the risk of kidney complications related to cardiovascular disease, high blood pressure, and diabetes. A 2023 study published in the American Journal of Kidney Diseases examined the effects of a plant-based diet over 5 years in individuals at various stages of CKD. The study revealed that higher consumption of meat, processed foods like white flour and rice, and sugary items was associated with lower life expectancy and poorer CKD outcomes. Conversely, increasing plant intake while reducing meat and processed foods can be especially beneficial in the early stages of CKD. Adopting a whole food, plant-based diet means focusing on fruits, vegetables, whole grains, legumes, seeds, nuts, herbs, and spices, while minimizing meat, dairy, and processed foods. This approach boosts antioxidant levels, reducing kidney tissue damage, and lowers blood phosphorus levels, which is often high in dairy products. 1. Monitor your health. Regularly check your blood pressure, blood sugar levels, and kidney function. Keeping these metrics within a healthy range can help manage and potentially lower creatinine levels. Consuming processed foods can be detrimental to bone health and blood vessels, particularly for individuals with chronic kidney disease, CKD. Reducing meat intake lowers blood protein levels and helps manage acid levels, preventing metabolic acidosis. High acid levels force the kidneys to work harder to maintain acid-base balance, leading to damage, inflammation, muscle wasting, and bone breakdown. Avoiding processed foods also helps limit the harmful effects of high salt, sugar, unhealthy oils, and artificial additives. In this discussion, we highlighted key habit changes to lower creatinine levels, such as exercising regularly without overexertion, increasing fiber intake with a plant-rich diet, and limiting salt consumption. Additional strategies include avoiding over-the-counter anti-inflammatories, improving sleep, and quitting smoking. We will now cover when to consult a specialist, additional testing that may be required, and potential treatment options, diagnosis, and testing. Creatinine is a byproduct of muscle breakdown that circulates in the bloodstream and is filtered out by the kidneys, exiting the body through urine. Creatinine testing that measures levels in urine and blood to assess kidney function and detect early or worsening kidney damage. Elevated creatinine levels can indicate a decreased glomerular filtration rate, GFR, and while high creatinine levels can result from muscle breakdown due to intense exercise or muscle wasting, they can also be caused by pregnancy, poor hydration, dietary protein, and bodybuilding supplements. Kidney-related causes of increased creatinine may include infections, certain medications, or blockages from kidney stones, tumors, or injuries affecting urine flow. Conditions like diabetes, high blood pressure, congestive heart failure, and excess weight also heighten the risk of kidney damage. Addressing the underlying cause of high creatinine promptly can prevent or slow kidney damage. Consulting a nephrologist, a specialist in kidney conditions, is advisable, particularly if you have related conditions like high blood pressure or diabetes. The nephrologist will review your medical history, conduct a physical exam, and order lab tests to determine the cause of elevated creatinine. These tests may include blood sampling for blood cell count, blood urea nitrogen, BUN, GFR, or cystatin C, as well as urine tests such as urinalysis, protein to creatinine ratio, albumin to creatinine ratio, or creatinine clearance. Genetic testing via saliva samples might be needed to rule out genetic disorders affecting kidney function. Imaging studies, including ultrasound, X-rays, computed tomography, CT, and magnetic resonance imaging, MRI, can help visualize kidney structures. A biopsy may be performed to obtain a kidney tissue sample for diagnosis. Treatment options. Once the cause of high creatinine is identified, various treatment options are available. Managing conditions like high blood pressure, diabetes, or heart failure can help preserve kidney function. Beneficial lifestyle changes include medication management, dietary adjustments, improving sleep, reducing stress, exercising regularly, and managing weight. Chronic kidney disease, CKD rates are rising, but daily lifestyle changes can potentially prevent progression. According to a 2023 review in Kidney Medicine, lifestyle modifications can impact creatinine levels and kidney health. Key findings include significant improvements from exercise, dietary interventions that control blood pressure and reduce protein leakage, and the combined benefits of weight loss and blood pressure management. While CKD may not be reversible in later stages, adopting beneficial habits can prevent further deterioration and improve quality of life. Patients may require long-term dialysis if CKD progresses, which can be performed at home through peritoneal dialysis or at a clinic with hemodialysis. In some cases, a kidney transplant may be considered. Regular monitoring and treatment of related health conditions, such as high blood pressure and diabetes, are crucial to prevent complications. We hope you found this information about daily habits to lower creatinine levels helpful. Watch more of Health Today's content to stay informed on trending health topics. A big thank you to all our subscribers and viewers. Your support motivates us to continue providing valuable content. Don't forget to hit the bell icon and turn on notifications to never miss a life-saving video.